Hey there, welcome back to my channel, ACT on Mental Health. My name is Sean Hardy, and I'm a licensed mental health counselor here in Fort Wayne, Indiana. Now, this channel was created for those that want to learn acceptance and commitment therapy, or as it's known as ACT, and for those that want to improve their life mindfully. So whether you're new to ACT or just want to improve your mental well-being, this channel is for you. Today, we're going to explore two popular therapy modalities, acceptance and commitment therapy, or ACT, and Dialectical Behavior Therapy, or DBT. We'll discuss how they differ, how they're alike, and how you can integrate both into your practice. Also, if you're interested in downloadable resources mentioned in this video, you can access them on my website, seanhardy.com, where I offer coaching services and a weekly blog on ACT-related topics. Let's start off with acceptance and commitment therapy, or ACT. Founded by psychologist Stephen Hayes, ACT is not a structured therapy per se, but it does offer some protocols for a variety of mental health disorders. However, ACT is more of a fluid form of therapy that is founded on processes rather than protocols. So if you know the processes, you can tailor therapy to target those. Now, the core aim of ACT is psychological flexibility, which is the ability to stay present and open to experiences while taking committed actions towards one's values. The central feature of ACT includes 6 core processes: acceptance, cognitive diffusion, being present, self as context, values, and committed action. To find where to target processes, simply invert the processes. So you have avoidance, fusion, distraction, self as content, pain, and short-term actions. The major problem is characterized as experiential avoidance. The goal of ACT is to help clients create a rich and meaningful life while accepting the pain that inevitably comes with it. Dialectical Behavioral Therapy, or DBT, was developed by psychologist Marsha Linehan. DBT is a structured therapy that focuses on the what and how skills acquisition. In other words, it is a practical therapy that emphasizes learning based on the biosocial perspective of a person being in a social environment with a brain, body, and behavior that is positively and negatively reinforced by others. The core principles of DBT is balancing acceptance and change, which involves the synthesis of opposites. By weighing the opposites, people learn to find the middle path between the emotional mind and reasonable mind, called the wise mind. DBT has 4 main skills that it teaches: mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. Teaching these skills is accomplished through the use of modules, which, depending on whether it's a structured DBT format or DBT-informed therapy, will include a DBT skills group, individual therapy, and a weekly check-in call. Or it will be supplemented in individual therapy as needed if it is DBT informed. The goal of DBT is to build a life worth living by helping clients manage difficult emotions and improve their relationships. Marsha Linehan wrote a memoir with this title, Building a Life Worth Living, that includes her personal journey with borderline personality disorder, which happens to be the population that DBT was first designed for and shows to be the most effective therapy for treating BPD. Despite their different origins, ACT and DBT share several similarities. Both emphasize mindfulness as a cornerstone of their therapeutic approach. They incorporate acceptance strategies to help clients with difficult thoughts and emotions. In ACT is through the core process of acceptance, and in DBT is through the skill of radical acceptance. Both therapies encourage clients to take meaningful actions and recognize the importance of dialectical thinking, the ability to hold multiple perspectives simultaneously. They are both third-wave CBT therapies that were created around the same time in the 1980s, and both emphasize behavioral principles. Unlike CBT, ACT and DBT typically do not confront or change thoughts directly, rather indirectly, whether that's through experiential learning with ACT or skill acquisition learning with DBT. Understanding the differences between ACT and DBT can help you decide which approach might be more suitable for your clients. ACT is rooted in learning theory, and specifically relational frame theory, focusing on psychological flexibility, while DBT is based on the biosocial model, emphasizing the management of behaviors and emotions in social environments. ACT sessions are more fluid and adaptable, whereas DBT has a highly structured approach. While both therapies are versatile, DBT is particularly effective for clients with borderline personality disorder, whereas ACT is broadly applicable. DBT starts every session, whether it's in group or individual, with a mindfulness exercise, while ACT may bring mindfulness when the moment calls for it, or teach directly how to develop mindfulness. There's a benefit in repetition and also in catching it in the moment. Another important difference is their focus. DBT's approach emphasizes managing destructive behaviors such as self-harm, suicidal ideation, and also therapy interfering behaviors like showing up late, missing or canceling appointments. ACT emphasizes what's happening in the room for the client, and so its focus is on the here and now. Just because ACT and DBT may be different doesn't mean they're not compatible. As a therapist, you can integrate elements of both ACT and DBT to create a comprehensive treatment plan that's tailored to your client's needs. For example, if a client has emotional dysregulation issues or interpersonal issues, it may be helpful to emphasize skill acquisition and psychological flexibility. You can use the skill acquisition part to equip a client using DBT skills, while also keeping in mind the psychological flexibility by clarifying values, by highlighting the pain of emotional distress, and moving away during interpersonal conflicts. You can also use mindfulness exercises from both therapies to help clients stay present and engaged. There's a variety of mindfulness practices that translate to both therapy settings quite well. The implementation of mindfulness exercises needs consideration based on the client's preferences and the therapist's preferences. Doing an exercise at the start may help some, but also may feel forced by others. We can also teach acceptance techniques from ACT to DBT to reduce struggles with internal and external experiences. Radical acceptance refers to accepting what is without changing it. It is just what it is. The process of acceptance is applying this idea as the client needs it by asking if they're willing to have this emotion, thought, experience as it is at this moment. Change is opposite to acceptance in a fundamental sense, but it's also important to improving life. We can help the change process by use of ACT's committed action and DBT's behavior change techniques to encourage meaningful actions. The ACT matrix and choice point do an excellent job of showing this to clients. DBT's homework and tracking behaviors help create the conditions for change outside of the therapy room. Lastly, we can combine ACT's cognitive diffusion with DBT's emotional regulation skills to help clients manage their emotions effectively. Language creates suffering when we become fused with thoughts, and that's how ACT views it. Likewise, emotions flood our bodies, which creates an effective action as DBT sees it. By decoupling ourselves from unhelpful thoughts and learning to influence emotional intensity, we can more effectively act. We must be careful, though, that we don't confuse clients nor utilize a control agenda when we speak of this. This video was getting a little long, but I wanted to include some practical interventions for ACT and DBT that you can try out. The downloadable link will be in the description below. As we wrap up, both ACT and DBT offer unique and complementary approaches to therapy. ACT is my therapy of choice for most clinical issues, but I appreciate DBT's emphasis on skill acquisition and use it quite a bit for couples in conflict and those with emotional dysregulation issues. By understanding and integrating the strengths of both, you can provide a more tailored treatment for your clients. You can also enhance your clients' lives by helping them to develop psychological flexibility and manage their emotions effectively. If you found this video helpful, please like, subscribe, and leave a comment with your thoughts or questions. For more resources, or if you'd like to work with me as your coach, visit my website, seanhardy.com. Remember, your journey towards a more purposeful and mindful life begins with a single click.